Watch my patient change his mind. The aim of good care is to put control in your hands. If he was not getting better, he would have opted for a surgery. So if you are considering shoulder, hip, or knee surgery, this video is for you. Now, if you don't care to hear the why behind this, skip to chapter 3 to watch David fix his shoulder. So let's discuss what is happening in our joints that causes this pain or restriction and how to differentiate between a joint that needs surgery versus one that just needs exercise. Then I'll show you my patient David, who realized he didn't need surgery after 3 visits. So David came to me with an MRI that showed a rotator cuff tear. He believed that the only way to fix this was surgery. Why did David's shoulder become stiff in the first place? So when an individual has a shoulder trauma or a rotator cuff tear, the body doesn't like that. So it surrounds the tear with materials, fat, mucus, a blood supply, and that blood supply has nerve endings, and that can kind of impede the joint mechanics. So when we see the MRI, we don't know if it's the tear that's causing your pain or if it's all that material that the body wrapped around it. My specialty is figuring out which one it is. If it's the stuff wrapped around the tear, you'll notice positive change with your range of motion and symptoms within days, maybe weeks, from beginning your treatment. I think we could all agree that we can't fix a rotator cuff tear in a short period of time. What we can fix, or smooth out rather, is the healing material that may be impeding the joint. David agreed to work with me for 3 visits to determine whether or not this was a true rotator cuff tear that needed surgery versus a stiff joint due to the healing process. Check out how he did. Drop that left knee down. That left knee, there you go, exactly. This is where I asked him if he thinks he needs surgery. You can see he says no. So the bottom line, David was given encouragement and coaching to continue, but he was able to make the ultimate decision to not have surgery based on his results. If you find this video helpful, please like, comment, and subscribe.